Welcome to Unmasking Social, where we talk about building real friendships and meaningful connections without masking who we truly are. I'm your host, Sharon Baum, a speech and language pathologist with an expertise in social thinking and how it relates to autism and ADHD, specifically with our teens and tweens. Let's dive in. As an SLP, or a speech language pathologist, I have read countless neuropsych evaluations, and some of them have been truly wonderful, just getting to the core of what somebody might be struggling in and what their strengths might be. Today, we have a guest from Dubai, our first guest from the Middle East, who is a neuropsychologist and has taken these evaluations to the next level, thinking about how to incorporate everybody in the community so that all voices are added into the conversation as the puzzle is uncovered into diagnosis, but then also giving feedback that all can understand based on strengths. Hello, everybody, and welcome back to Unmasking Social. Today, we have someone from Dubai. I believe, Marianne, it is 8 p.m. where you're at right now, right?
Yeah. Yeah.
It is our first guest from the Middle East, and I am so excited because Marianne is a neuropsychologist who currently lives in Dubai. She does many assessments, but her assessments are very much geared towards bridging the gap between what she finds and how to bridge that with what she's going to do with those results. Marianne, I'm going to pass it over to you because you have a long history in being involved in autism and also diagnosing ADHD and all the other neurodivergent characteristics. If you don't mind me asking, where did the journey begin for you and how did you become so connected to these assessments?
First of all, thank you so much, Sharon, for having me. This is my first podcast ever. And it's an honor to be here on your platform, such a dedicated and passionate professional. So it's really an honor for me to support and to participate to your platform. So this is just a big thank you. I think my journey started, I can remember very well that my journey started towards neurodiversity affirming practices at the time of my motherhood, of when I became a mom. And I think there were many factors combined together that brought me to this approach. But I think one of the most memorable moments was one day, I don't know, I had this insight of, Marianne, one of these children is going to read your report. And will you be as proud as now him reading how you are describing him? And this, I think, was an insightful moment for me to start looking for alternatives. And I find that it's not the full story. I'm not telling the full story and I'm not being true to this child. And this is how I started looking for alternatives and brought me to learn more. And I'm still learning every day about how to write better, how to assess in a way that is true to the child. First, of course, the child, his family, and then, his experience.
I'm not surprised by that because for all those that don't know, we did have a call prior to this. And I felt the way you were speaking about me, I felt the same way about you, how dedicated you are. I think it's fantastic that when you had your child and you entered motherhood, that is when you said, wait, when my child grows up and he gets to read the report, right? And I believe you have 2 children now, right?
Yeah.
And when they both read the report, you're going to want them to be proud of you. And I feel like that's something that's so meaningful because you're thinking about how your children are going to perceive you. And that speaks so much to your character. And I'm not surprised because we had our prior call and I felt an instant connection to how down to earth and real and genuine that you truly are. So when we think about these reports, it seems like you work really, really hard on these reports because, again, you want your children when they start reading. And I mean, one of them already started reading, I believe, but when they are able to read these extensive reports, which some of us can't even fully read yet, right? You want them to really be truly proud. And so how have you harnessed that skill? Because so many neuropsychologists and so many reports that I have read incorporate a lot of the ADOS-2, for example, for the autism classification, which is something that I'm familiar with just because of my experience in the world of autism. They use other clinical platforms. But do you feel that you're doing something different in the sense of looking beyond the assessments so that you can really get to know the child to see, wait, what really is going on here?
I think I'm going to share something. At the time when I was doing my ADI training years back, the last slide I remember very well ended on a quote that shaped later a lot of my practice. And this quote said that not everything that is measurable or measured matters, and not everything that matters is measurable. And I think so, not everything that we can quantify matters at the end of the day, and not everything that scores 10 really matters. And I think this sums it all. As I told you at the beginning, it's really a lot of factors that made me connect and engage in a more neuro-affirming practice and more strength-based practice, because beyond the scores, there is, I would say, a full life, like a lot of dimensions of layers that scores do not capture. And at the time, at the beginning of my practice and at the time when we train, the best report used to be compared to a picture. So the report needed to be a full picture of how the child is functioning at a certain moment of his life. So his cognitive, his learning, his social, his attention, his language, etc. And now I love drafting reports, even though it takes endless hours, but it gives
I don't think people realize just how long it takes. I mean, some of them are 15 pages long, right?
Yeah, it's really a lot of time. But I think now what I would like to see more, instead of comparing the report to a picture, probably comparing the report to a short documentary that really capture all the multidimensionality of a neurodivergent brain. And a picture or tables or scores or graphs or percentiles or do not at all reflect truly the functioning of a child. And it's not only the functioning, his lived experience. So yes, this is what I would love to see, more of a small narrative that takes us to nuances in his life, of sounds, of people around him, of different settings, of how internally this child lives school, lives home, lives academics, and etc. So yes, so probably this would be amazing.
And I see the passion in your eyes. This is also a recording, but for those who can't see it, Marianne's face is lighting up as she speaks about this. And so I could see just how much you wish for this, right? That this becomes more of our practices. There are people in your tribe that are like you, right? That you connect with, obviously, that are doing this, but we need more people to really think about it. And you touched upon a couple of amazing things, which I never thought about it, but picturing the child as if we're telling a documentary of their life story from beginning to where they are now, because so many things can change. You also touched upon how not everything that's measurable matters, and not everything that matters is measurable. I think I just quoted you correctly.
Yes,
right?
yes.
But it's so true. Not everything that matters is measurable, because a lot of times we try to measure things like social, for example. And as a speech pathologist, I've always found it very difficult to measure social, because there's so many different things going on with social. And I've had people on this podcast where we discussed that. How do you measure that, right? 80% of the time the child was able to maintain eye contact. What does that mean, right? I mean, right now I'm looking at you and I'm looking away. And if you were going to measure me as a neuropsych, what would I get? 70% of sustaining eye contact? I'm not going to stare at you right now. I don't want to make you feel uncomfortable, Marianne. I know that we have different cultures, but in the Middle Eastern culture, that's unacceptable, right? To just stare as well as here. So it's just not so measurable, and not everything that matters is measurable, because I have seen that there are so many functional needs, like day-to-day living things, that we sometimes ignore in the reports.
Exactly.
And you nodded, so you can speak to that a bit more. But my final thing that I'd like if you can touch upon this, is also, so I spent a few years before going back to my clinical speech and language pathology role, which I love. We spoke a little bit about it, but in administration, where we actually looked at these evaluations in the New York City public school system for preschool children, and then tried to make determinations based on that about what programs are appropriate. But we never met the child, which is crazy. And then based on those reports, we were supposed to, with the family, with the teachers, and with the reports, and with the teacher reports, we were supposed to make this determination about what the child needs. If they need special education, what do they need? The problem that I found, and maybe you could speak more to this if you agree, or if there's something that you found to be more helpful, is that this is a moment in time, right? So like when those evaluations are done, we always repeat, this is a moment in time. This is a snapshot in time. Maybe the child was hungry that day. Maybe the child didn't sleep the whole night last night. Maybe the child's not connecting with the evaluators and something is going on, in, like you said, internally, right? So how do you overcome that piece of you're doing this evaluation? Sometimes it could take a few sessions, but that's all the time that you have with the child, right? Unless you're doing some observations outside of that. So how are you able to bridge it all together when it's really just a snapshot?
So first of all, I would say having multiple voices and multiple settings as much as possible. So I would say not most of the time, but a lot of the time, how the child presents in the office and how the parents, the story that the parents bring from what they see at home is totally different, is structurally, I would say, different than what the teacher is describing. And this happens a lot of the time. And it's not something to be afraid of, I would say, because these are not contradictory information. These are information to be combined together, and this difference in between the settings tells something. So a lot of the time, the narrative or the story that the parents bring from the home environment, let's say, example, a child who has very strong emotional and behavioral responses in the home environment, a lot of meltdowns, demanding emotionally, behaviorally. There is a lot of conflict and stress in the home environment, etc. From the other hand, when we collect information from the teacher, we read a totally different story, which is valid. So all these different facets or these different presentations are not contradictory at all. These are probably signs or signals for us to see that there is something happening. And this is what we call masking, or when cognitive load or overload happens in one setting and not the other. And here we have our scores as well that also play a role. So we have the scores, we have the parent's narrative, we have the teacher's narrative, and we have the child's perspective that is very important. And more recently in the practice, I would say the past 2-3 years, I started having tween and teens who are coming themselves and saying...
You read my mind. I was going to just ask you about that next. Yeah, you read my mind. Yeah.
So coming, and I have a lot of respect to these parents who still bring their children while they are not seeing any difficulty in the home environment. The teachers are just writing poems about their performance, their kindness, their social skills in the school environment, but still the child is feeling, or the tween, the teen, is feeling that something is different. And they are coming for us. And I would say 100% of the time, yes, something was happening. They were different, they were neurodivergent, and they were very clear about it themselves. So it is tricky because we can have multiple facets, but this is neurodivergence. It doesn't present the same way in the different settings, and it doesn't present the same way every day. And so I don't know if I answered your question, Sharon.
Yeah. I think that's excellent. I think that you are so tuned in to the individual needs and the individual settings, because as we know, like you mentioned, masking can occur in different settings. So the child might be masking at school and then decides to unmask at home, or in the reverse, decides to mask at home and then unmask at school. And then you're seeing completely different children, right? Or completely different teens and tweens, which is why you try to look at it, like you said, like a whole picture, which you mentioned is not contradictory. It's just different moments in time and how the child is acting. And what I've observed is that some teens and tweens feel like they need to mask in school because they want to fit in. And fitting in is so hard. I mean, I don't want to go back to those times. Lord forgive me, but teens and tweens, it's a hard age and everybody wants to try to fit in. And so they may be not really showing that side of them, which can leave also parents confused, because then they come home and then they're acting like somebody who is completely different, or in the reverse, they feel like they need to mask at home because they feel like their parents won't accept their differences depending on the culture or the environment. And then in school, suddenly they're unmasked completely, even though it's a structured environment and the teachers are noticing things. And so that's where I think not conflict happens, but where there can be some confusion, which is why I really give a shout out to you for really trying to take these pieces of the puzzle, put it together, and also take in the voice of the autistic or the neurodivergent teen and tween. And if they're younger, obviously, they don't really have that voice yet to advocate. So it's a little bit harder, but I guess through observation, that's the big thing, right? That you're able to do. But so I'm just curious, just as like a fun fact.
Can I just add something?
Sure,
Can I just
absolutely.
add something? So when you have all these information together, and like previously I used at least to consider that the data or the scores that we have gathered are the most valuable in the equation. And now I think that it's very important to treat these scores as one part of the equation only. And the other parts are as valuable and as important to understand the full picture as the scores. So before, we used to feel that the scores are the prime, like they had the biggest importance in the whole equation. But now, how I treat these scores, they are part of the equation along with what the parents are bringing, what the teachers are bringing, what the child is saying, all together. And sometimes, and many times, the scores are insignificant. Sometimes, like, the scores are not in line with the others. So what would you do?
So it's interesting that you mentioned that, because it sounds like what you're doing is you don't want to come in with any preconceived notions or any biases. So it sounds like what you're doing is you want to listen to everybody first, get that informal information first, right? And then do the testing and see, oh, okay, is this aligning? Is this misaligning? If it's misaligning, why
What
is
does
it
it mean?
misaligning?
What
Right?
does it mean? What does
So-
it say?
Right, which I think is fantastic, because I think that what you're doing is you're coming in with a clean slate. And I've had colleagues, just even speech pathologists, who said, I don't want to look at anything. I don't want to look at the reports. I want to meet the child first, right? And then see if my inclination is correct, which power to you for doing that, because I think that that's probably the best way to get to know someone. And it's interesting because here in New York City, it's actually a melting pot of every sort of culture, right? You can find any sort of food, any sort of language. You could ride the subway with literally 50 different nationalities. And because of that, we actually have a protocol in place in New York City that when you do an evaluation, if the child is bilingual, we are not allowed to look at scores at all, meaning the child is not really scored in any of the areas if they're bilingual. But if they're monolingual and they speak one language, then they can be scored. So I feel like we are heading into some direction. The reason why they do that with the bilingual children is because these tests are not normed on bilingual children. They're normed on American English-speaking children. I'm not sure if you have anything like that too, if the scores are more focused on if the child's bilingual or not. But it's interesting because there's like a focus on, hey, we can't really have the scores represent the child because it's not normed on them. But who exactly is it normed on? Like, I don't mean to take away that I'm saying everybody's so different that the norm is a sample size of everybody who fits a certain norm, but none of our neurodivergent children and teens and tweens fit a norm. So it's like, what is a norm for when it comes to a group of people who are so different from one another?
I would say that definitely the norms that we are using here in the Middle East are the ones that we take from the US, from the UK, from Canada, and definitely we have even a bigger gap when it comes to the norms. But this is what we have, and we have learned how to use them. And this is why it's very important to have like broader even sources of information while testing. And I still think, I don't know if I'm going to like evolve, my practice is going to evolve, but I still think that some structure is still needed. Like the structure of scores and quantitative data is still important. It really draws. But then like how you interpret it, how you use it is a different story.
Yes, that's a key difference. How are you going to interpret the data? The way you interpret it sounds like, okay, I'm actually coupling it with, like you're almost marrying it with your informal assessment. And then that could actually help and support, it sounds like, because again, there is a room for all these testing and they've been done for many years. But again, I think the world is shifting, society is changing, becoming more neuroaffirming. And so understanding that for all children, we need to look at both the informal and formal assessments, which makes me think about how sometimes like the picture is so different. Like you said that you imagine a child, right, based on what you hear or what you, let's say you're speaking to the parent and you're hearing something, or you're speaking to the teacher and you're hearing something and you haven't met the child. I don't know if that happens or you haven't met the child yet, but you're taking just like an informal intake assessment and then you meet the child. And then have you ever had a situation where all of a sudden you start noticing that the child or teen and tween is actually quite different than what they've been portrayed as?
A lot of the time. A lot of the time. And you know, this shift can go both ways. It either bring me to discover that the child or the tween or the teen has much more strengths than what I heard from parents and teachers. And sometimes it brings me to struggles that were not highlighted by parents or teachers that we could see. So this like shift of perspective of understanding can happen both ways.
Yeah. And I've actually seen that even when I was working for a couple of years in administration with those evaluations and I would review them, or even as a speech pathologist reading through neuropsychs. It's interesting because sometimes I find that there are areas of weakness, let's say, that aren't presented. It could be because maybe the parent isn't seeing it in the way that we professionals are seeing it.
Yeah.
It could be maybe because in the classroom, they, like you said, there's masking going on. It could be for a variety of reasons. It could be that maybe some people don't want to acknowledge. It's so hard. Like, I'm not a parent yet, but I can only imagine how hard it is to acknowledge something that could be perceived as a weakness or something that a child can't do, right? Or what I found is all of a sudden I'm hearing all these things and I look and I start listening more and I start thinking, wait, I don't know. I think people are focusing sometimes more on the deficit than on the strength. Like, what can't the child do? And I think that's hard because a lot of times when writing these reports, right? I mean, you have such a big task, which is, here's my child, figure out what's wrong with him. And it's so easy, from my perspective, and correct me if I'm wrong, it's so easy to fall into this trap of, let me figure out exactly what's wrong. But that trap could also lead you down finding everything that's wrong with the child and can also hinder thinking about, wait, what can the child actually do successfully? Have you found that that can sometimes impact the practice, not just yours, but other neuropsychs in general?
Totally. We were trained to hunt for symptoms. And the quicker we find the deficits, our job is done. We have evidence for like ruling out or confirming a diagnosis, and that's it. So if you want to take it in a diagnostic perspective only, then okay, you have done your job. But I think our jobs is much, much more than this. And I would say mistakes or deficits is very easy. You feel that our eyes are much more trained for different reasons. Is it for like training, society, norms? Our eyes are much more trained to catch mistakes, flaws, deficits, and less trained to catch strengths. And I would say even that it's difficult, and in some cases, it's really difficult to find strength. And also, this is for different reasons. One of the reasons is because sometimes we don't really value some strengths. So a lot of parents wouldn't say that he is kind or he is generous because they don't know how to make use of it, like to support his difficulties or his differences. So that's why sometimes we undervalue some strengths because we don't find them useful or we don't find them supportive enough as well. But like when a child is kind, how many doors can be opened for him in his daily life when he's kind to others, to his classmates, to his teacher, how much people also are like welcome him with open heart and would really like to make everything possible to help him with the simple thing that he has. He is kind or he is generous. So I think it's very important not to undervalue anything because every strength has its play in building resilience, in building support, in building happiness.
Yeah, that's such a good point. I never thought about it like that, Marianne, and that's why you're here. But I never thought about it in that way, that we undervalue strengths. And it's so interesting because you're in the Middle East right now at nighttime. I'm here in New York City, almost 1:00 in the afternoon. And yet I feel like I'm speaking to a colleague here because what you just said is exactly how I feel, which is those strengths are so crucial. I don't think people really value when you say the word or the phrase, rather, they're kind, they're generous. I don't feel like people really understand how that can impact their social abilities. And when we're dealing with the neurodivergent community, social is so important. If a person is generous and a person is kind, we can optimize those abilities because now we know that they can be able to maybe collaborate on something that they really like with somebody else. We know that their kindness will allow them to perhaps make a friend or initiate with somebody or work on a group project, right? Which is so critical in those years. And so how can we not value all those things that can contribute to social, which is at the center of your
Connection.
evaluations? Exactly. Social, right? And so kind and generous, I know that sometimes they don't even like when we speech pathologists use the term, oh, they're kind and generous, like that's not specific enough. But
Exactly.
but why isn't that specific enough? That is highlighting a strength.
Again, it's not quantifiable.
Right.
And that's what, that's
a
why.
good point. I think that's what it is. I think that no matter where you are in the world, if it's not quantifiable, then why are you explaining it, right? Why are you expressing something that's not quantifiable? But that's why I think that we have kind of come along in a nice direction in the sense that right now we are more neuroaffirming. We're operating like the program I worked in for many years, very much based on strengths and interests and thinking about strengths and what we can do with those strengths. However, like you said, there's still a focus on what does strength actually mean? What is considered a strength versus, for example, a strength could be that they know how to advocate for themselves, right? But that's a loaded thing. That takes time, right? That could take many years. And then in terms of advocacy, how they advocate may look different. So that's why those things are really important, especially in the younger years, to recognize, wow, generosity, right? They're going to be able to work with others together. They're going to be able to do a lot of things. So that's so interesting how sometimes it's just that we don't know strength, and that's why it's not truly being recognized. But Marianne, you've done so much work collaborating. And the word collaborate is thrown around, right? It's such a buzzword, collaboration. Everybody says they're collaborating, right? I mean, we all want to say that we are, but you really have done such great work. And one of your focuses is on not just doing the assessment and saying, all right, I'm done. I figured it out. The puzzle is completed. You also take it to the next step, which I think is just amazing. And I just don't meet that many people that do that, where you then set up a very specific system so that the child can be included, or the teen and tween can be included in a way that best supports their needs. Can you explain a little bit of the magic that you're doing with that? You're a magician too.
Yeah. There are two things I think that for me are the core value of the whole assessment procedure. The feedback and the feedback for the parents. And I'm going to give more detail, like some examples. And another thing is the psychoeducational brief therapy that is given to the child himself. So what I have found that was very useful in my practice is during the feedback, instead of keeping the feedback oral and handing this big document that a lot of the time is not read, unfortunately, by the past. It's difficult to navigate as well. It's not always written in a parent-friendly way.
True.
What I have found that was very useful and very powerful is preparing visuals during the feedback to have a summary of the findings of the report, really going very slowly on the strength, the challenges, and the recommendation. So these are for me, so really preparing sides like visual and having really a good discussion with the parents and not setting. So sometimes the feedback session is so dense and really loaded with information that I always send them, take the report, take some time, and then come back to me after a week or after two. And please do not settle if you haven't understood well the outcomes, the recommendations. Please come back, because this is what is the most important part for me. If I need to answer the referring physician, it takes 2-3 words and that's it. I don't really need to go through all of this.
Right.
So this is one. And during this feedback, my language is central. Reframing the story, removing the stigma, removing the misinformation, and keeping it to the core, as true as possible to what the lived experience of their child is core, because the language I'm going to use is going to be their language that they're going to use with the community, with the extended family, with the teachers. So it's very important to have a narrative that is positive and that is true to the child's voice as much as possible. So this is so the feedback session is key for me. And the second part is this small psychoeducational brief therapy that we do over 4, 5 sessions, 6 sessions with the child for him to understand his brain, to understand how his brain works, and to build these bridges between what he is going through at school, with friends, at home, with siblings, with parents, how these can be explained in ways that there is no blame, there is no guilt, there is understanding, there is acceptance. And there is a tool that I wouldn't recommend enough are the tools that of Dr. Liz Engo, explaining brains, that I use extensively and with so much passion to really help the child better understand his brain, how his brain functions, what is easy, what is enjoyable, and what is more tricky for him. And I think this understanding by itself him understanding that nothing is wrong with him and that there are so many brains in this world that look exactly like his brain or close to his brain, and there's nothing wrong with this. So I would love to see more parents engaging in this of the post-assessment, I would say, work.
Marianne, you're setting the bar really high right now. So for all those listening that are professionals that are in the field, that are neuropsychologists, the bar is set high here. And I think this is so important because what you're doing is really preparing for the child when very often they're very unprepared, because a lot of times they come our way, let's say into the school setting, and they're placed in a specific setting. They don't really understand why they're there. They feel self-confidence challenges because they feel like maybe they're not as smart as their peers, which isn't necessarily the case at all.
Mm.
In fact, there are some cases they're much smarter in many, many different ways. And we know that intelligence, and you're obviously the expert on the multiple intelligences in many other ways, but they come in without having that psychoeducation piece. And so then they feel like they're just a failure, and they're getting these services like speech and language therapy and occupational therapy. And it's very defeating, especially in the adolescent years when they see other brains are working in a different way. So I just love that you're carrying over, and you said like about 5 and 6 sessions, giving the psychoed so that when they go into whatever setting it may be with whatever services they are recommended for, they have actually a baseline of understanding that their brain is just working differently. And that brain that's working differently can actually do amazing things, because the way my brain works can't do a lot of the things that my students can do, to be honest with you. I mean, that's just the way it is. And Marianne, our brains work differently too. But you also touched upon something really pivotal, which is, I love the fact that you're using like these visuals, right? Because obviously you have to include clinical jargon. I mean, you have to, right? You want to make it as parent friendly as possible, but you're also a clinician. You're a neuropsychologist. So you have to include a lot of clinical terms. But I love how you have in the feedback session, the visuals, and then that's followed by the strengths, and then the challenges and the recommendations, right?
The recommendations.
I'm so curious, if you don't mind me asking, the visuals that you're using, are these visuals related to the individual, the brain?
Sometimes it can be the charts. It can be a chart and really explaining if I'm, for example, speaking about intellectual functioning or academic achievement. Sometimes it's just bubbles, like, for example, just to, let's say, I don't know, Emily. So
like
let's
bubbles?
so bubbles.
Like thinking,
Just bubbles saying that today, Emily is struggling with language, with executive functioning, and with social communication, let's say.
Oh,
and
that's
starting, it's as simple as this. And then starting to link, for example, this is why, for example, when she needs to defend herself, it takes her more time to defend herself because her language processing is a little bit slower. Like, so trying to really bring these examples that they shared at the beginning and structuring them in these bubbles so they really understand what's coming from language as much as possible, what's coming from attention and sense regulation, what's coming from social communication and social understanding. Because also many of the parents that we see are also neurodivergent. And we really need to make it as well. So the assessment need to be as inclusive, as flexible, as broad, as meaningful as possible for this child and for this family.
I mean, I know that I would need that because everybody's different, but everybody's brain works differently. But I know that when I read reports, sometimes it becomes so chaotic and messy. But the way that you're explaining it, it's almost like a graphic organizer where you're just really putting pieces and you're explaining the why. This person's having this difficulty and this is the reason why. And I love how you bring in the fact that a lot of the parents are neurodivergent too, which we've seen this so often. And so I've seen that very often too, where the parents are also neurodivergent. And so you're really being, like you said, flexible and neuroaffirming, not just to the students, but to their families as well, which is just fantastic. you really are setting the bar high. I'm sorry for anybody listening, but I feel like this can be modeled in so many ways. The way that you structure the feedback session, the psychoed after, I feel like that just doesn't happen enough. And I'm just glad that it is happening and that maybe you'll be the trailblazer for other people to maybe incorporate this. And I understand that time is hard. And I know that neuropsychologists are really overloaded, especially right now when so many people are questioning whether or not their child might be neurodivergent. I know that it's hard because you have to commit a lot of time to doing what you're doing, but it seems like it's really worth the time because it really can prevent. It's like really a preventative measure of all the difficulties that the individual is going to face. And related to the difficulties that the children are going to face, so you actually have the teens and tweens, when they get older, they can come to your office, right? I mean, they're always in your office, but they can actually speak up a little bit, right, about their experiences. They could speak up more, obviously, than when they're younger, and you really incorporate their voice. Do you find that the teens and tweens do a good job at speaking up for their strengths and weaknesses and in a way that kind of pulls the picture together? Do you think that because a lot of times with self-awareness still developing and all those other social emotional components, do you still feel like they understand kind of why they're there?
I would say even before being a tween or a teen, a child start feeling that he is different or she is different. And they have their ways of saying it, of expressing
communicating it.
Yes.
Not just with words, right? Yeah.
So sometimes it's with frustration. Sometimes it's with sadness, like the amount of effort that I have to do. Example, like they know, they feel it. But then when you are a tween or a teen, this is when you start putting it into full sentences and you start having more experience. You start comparing yourself much more at another level. And definitely, I would say the professionals who are being extremely vocal, not extremely, or vocal, and doing a great job in studying information, I think it's being extremely useful because we are seeing this in the clinics where tweens and teens are coming because they are much more aware that probably something is different. I need to understand it in order to make use of it and not to have to put more effort or feel more anxious. So I think that is much more awareness and it's going the right way.
Yeah, that's great. And I love the optimism. And I see the same thing that you're seeing where everybody's just more aware of this right now. I just remember growing up and there was just very little awareness when I was growing up. And I'm sure you feel the same, right? And now we're in the place in society where we're building awareness, even just in the community at large, not just in the neurodivergent community, but community in schools and in general. And you mentioned that a lot of times these teens and tweens will come to you. They already are feeling like something is wrong, but that's because the awareness has already been put on their radar. So they're already recognizing it because they've been educated about how there are different brains and things like that. I just want to ask you one final question, and it's really just also a suggestion if you have. As we think about the future, I always like to think about what is your hope for the future as it pertains to these assessments, making sure that the assessments line up with the child and kind of creating a space that's as neuroaffirming as possible. Is there a way that we can shift things to even optimize it more? Because it sounds like you're in a wonderful place in what you're doing, but is there anything that you hope for society in terms of changing things so that the assessments can really lead to a direction where the children, the teens, the tweens, the adults really feel understood?
There are many things that I'm still also learning and evolving as a professional. So I would love to see probably less writing and more time with the
I
parents,
agree with
the
you.
child. So probably if I had the chance to write just 2 pages and these hours that I put into paper, if I could put them with the child at school to help him self-advocate, to learn about his brain, probably shorter reports and more time, and use this time with the family, with the child. So this is one. Two, having more flexibility when it comes to the protocol as a whole in order to capture as many nuances and as many dimensions as possible. Having more psychoeducation, like having psychoeducation as a built-in part, probably like less writing and more psychoeducation, and this therapy afterwards would be much better. And always remember that the scores do not define everything. They are part of the story, but they are not the full story.
I just love I love those points. All those points are such important points and are all nuggets that I think anybody listening can gain from it, whether it's a neurodivergent individual who's struggling to fit in and is listening to you and understanding, well, wait, my brain just works differently and maybe I wasn't given the proper psychoed, right? Or from the parent that is trying to understand the strength and what strengths really mean. I love how you touched upon how strengths just aren't fully understood completely, what a strength really is. And then just like you said, the scores do matter and there's a reason why they're there, but really getting to know the full picture as a documentary, right? With the scores, right? Separate from the scores and then putting it all together. Marianne, I can't thank you enough for having you here today. I know that it's late over there and you spent part of your evening with me. I'm sure
it was a pleasure.
So many people, thank you. I'm sure so many people who are listening will be able to connect to this episode and just learn how we can move forward in ways that you already have developed. And you make a good point. I'm also evolving. I also am trying to be the best version of a clinician that I am. And I do really relate to you on the writing piece where we all are just bogged down by the writing. And for those of us who love the children, we just want to spend more time with them. So whoever's listening, if you're higher up in education, just listen to us, okay? We need less writing. But Marianne, where can people connect with you? Whether it be on social media, if you feel comfortable, or anywhere else?
Yes, I have a social media. I have an new Instagram. I'm very new to social media. So yes, through Instagram, probably, yes.
Is that the best place?
I have a website as well. Yes.
Oh, your website. What's your website?
MarianneDiab.com.
Oh, so you keep it simple, keep it to the name. Okay. But thank you again for joining me.
Thank you so much, Sharon. It was a pleasure for me.
True pleasure for me too. Yeah.